Oh, wait. No.
He always gets the wrong one. He even labeled them.
I do.
This is the Wandering Minds podcast, and I am Mickey.
I am Mike, and today our special guest is Dr. Justin Coryell.
Hello.
Welcome, my friend. Thank you. So, Dr. Justin, tell me about what kind of doctor you are, first and foremost.
Well,
I personally know because I've seen you, but for the millions of people out there.
So I'm a chiropractor. Grew up here in Thurston and, went to Oregon State and then went down to California and got my degree, and I'm a chiropractor.
Cool.
Nice.
Yeah.
How long have you been a chiropractor?
Well, I've been practicing since about 2015, 16, adjusting when I was in school.
Okay.
I graduated in 2018.
Nice.
And then I practiced in California for about 2 years, then moved here.
Oh, okay.
Yeah.
So now tell the people where you're located, where your office is located at.
Yeah, so we're located in Springfield, Oregon at 384 Q Street.
Yes.
So right off Q Street.
Which is right, for anybody who knows where the bow rack is, it's right in that same little,
the parking lot?
Industrial.
Yep, we share a parking lot with the bow rack.
Okay.
Yeah.
Yeah.
It's a great location for me. You're literally 2 minutes away from me.
I know, it's great. That's what everyone tells me, and we're right off the freeway.
Right
so
off the freeway.
I get people that come from Salem. That's kind of the farthest, but Albany, people come from the coast.
Cool.
It's really nice, that little exit right there off the 126, and you're right in my office. So,
super simple.
What's the name of your practice?
Advanced Sport and Spine Chiropractic.
Nice.
Yeah, and I actually have a massage therapist with me, Josh Pugh, and he's movement improvement. And we took over this building together. So we split. We split the rent. We split, what we do. We share patients. Chiropractic and massage goes really well together.
Yep. Oh, absolutely.
Usually, chiropractors have their massage therapists that kind of work for them. But Josh was a really good buddy of mine, and so he wanted to do his own thing. So we just kind of helped each other out. It's been smooth. It's been really good.
Nice.
That's good. And, again, going back to, because Mickey works for Tyler, who's a physical therapist. You also do some of that, correct? Physical therapy?
Yeah, we're not technically allowed to say physical therapy. We have to say physiotherapy, so it's different.
Really?
But because PTs have their jam and chiropractors have their jam.
Gotcha.
The school I went to is a little more integrated. You know? And the practice I practiced at in California, we had nurse practitioners and physician assistants and physical therapy with PTAs there. So we did a little mix of everything. Here, I do a lot of physical therapy work with people. You know? So I do a lot of soft tissue. I do cupping, I do scraping. I teach you kind of what to do at home, though. That's what kind of separates me from other chiropractors is I'm not trying to get you on a plan or get you in 3 times a week and do that whole spiel. My job is to get you out of my office.
Yeah, I think it should be with all. I feel like massage therapy, chiropractic, and physical therapy all work great together for different reasons.
Absolutely.
But the angle really should be like, you can function great now.
I'm working myself out of a job with you.
Yeah. And not everybody has that mindset. But that's how I think it should be.
And we've had this conversation. I've had this with Mickey, and I've had this conversation with you. And there's chiropractors are a dime a dozen. Yeah, they're literally a dime a dozen. And some of them are great, some of them not so great. But it seems like the not so great to the in between are like you're like cattle. They want you to just keep coming back. So that you go in there and it's like, okay, pop, 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 you're done. For me, I'm fucked up from toe to top of my head, literally. So I need certain things for certain times a day. And I went to you 2 days ago. I actually took my whole family to you. Yeah. We all feel amazing. But what I really appreciated that you did versus my other chiropractor, who I love, is you did the massaging stuff. Because I find that with my lifting style, the massaging those muscles that are super tight, that was like, I felt amazing leaving there. Whereas generally speaking, just an adjustment. And again, the adjustments work great. Yeah. But the muscle tightness is what was really affecting me.
Yeah. And that's kind of new school. Some of the older docs around here, a lot of the older chiropractors, not old, in their 40s.
No, I know what you're talking about. The established.
Exactly. The established ones. They do the 5 minute, kind of like cattle, like you said.
Yeah.
But some people want that. Some people just want a quick adjustment and they just, just get me popped, get me out, let's just keep this thing moving. And that's totally cool. That's not kind of my jam. I spend a lot more time, I get a lot more personal with my people, and you tell me something that's going on and I'm like, okay, well, this is how you fix it, and this is what you do at home. I only get you for 30 minutes, right? What are you doing with the rest of the day? So, I teach you what to do, how to foam roll, how to use a lacrosse ball properly, how to stretch properly. What's the difference between stretching and foam rolling? There's a lot of education that goes behind it, which I think is way more important because you've got 23 and a half hours in that day, right? And I get you for that 30 minutes. So what you do at home is way more important.
Absolutely. No, that's great. Especially for people like Mickey and I and other people who lift, especially heavy.
Just athletes in general.
Yeah. But even as you saw with my youngest daughter, she has issues because she carries a fucking heavy ass bag on her back at school, so it works for it's functional for everybody to learn those things at home for sure.
Yes, exactly.
Yeah.
So what got you on your path to, is it chiropractic?
Yeah.
Is there a cool other word for that?
Chiropractic.
Okay.
It's a pretty cool word.
It is.
It's fun to say.
It's kind of funny because I was in between what I wanted to do at Oregon State.
Okay.
And I was pre-med. That was my, background of what I was doing.
Yeah.
But it was kinesiology, biology.
What is kinesiology real quick?
Kinesiology is just the study of movements.
Okay.
So it's basically just movement patterns, movements.
Gotcha.
Big words.
Yeah.
Make you sound really smart.
Right.
But yeah, so I graduated at Oregon State with my kinesiology degree.
Okay.
I didn't really know anything about chiropractic. I didn't know how I felt about it. I'd never been adjusted before. My mom used to go to a chiropractor in Springfield, and she loved it. But I was like, I don't know about all that nonsense, that witchcraft.
Right.
So the last year at OSU, I'm an avid basketball player. I played at least 5-6 times a week, right?
Wow.
Yeah, lots of basketball.
Yeah.
I threw my back out at OSU and went into some medical doctors there, and they're like, we're not going to prescribe you any drugs, because a lot of students go in asking for drugs. So they're like, oh, here's some Advil. Try this first.
Right.
But they were like, why don't you go see a chiropractor? And I was like, I don't know anything about it. I don't know how I feel about it. And they're like, just try. So I went to, can I drop names on here?
Yeah, absolutely. That's fine.
So I went to Dr. Horesco and Horesco Chiropractic in Corvallis. Super cool guy. He had like 4 or 5 chiropractors working under him. And I went in there and kind of just shadowed. And he taught me about chiropractic. So I threw my back out. I went in there and I worked with Dr. Ort. Okay. And he kind of explained chiropractic to me in a way that made a lot of sense. When a joint's not moving, we want it to move. Yeah. So, I'm going to go in and I'm going to make that joint move, basically. So a lot of people have this misconception of chiropractic, bone popping, bone out of place. That's all kind of older, lingo. There's no bone that goes out of place, right? There's no cracking that happens with the bones. Joints get stuck, and we need to go unstick them, basically.
Okay.
That's the way I explain it to people, in layman's terms. You got something stuck, let's go unstick it.
Okay.
And that popping sound is just me unsticking the joint, releasing that nitrogen that's built up in that joint.
Yeah.
So,
I always wondered what the popping was.
Well, I knew it was gas, right?
Yeah, So when the joint's not moving,
over here. Hear her back pop.
Yeah.
He didn't mean my back.
Well, yeah, when the joint's not moving, nitrogen builds up inside of it, and it kind of joints need to be lubricated with synovial fluid, and when the joint's not moving properly, it's not getting that fluid that it needs, so nitrogen builds up in there. And when I go in, it's like, oh, this joint's not moving. When I was palpating you, and I was like, oh, that's kind of stuck. Oh, we need to get that.
Notice
one too.
the ooh part.
That one right there.
Yeah.
So I go in and I release that joint, basically, and that popping sound's just the nitrogen leaving the joint.
Where does it go?
Back out into your bloodstream.
Okay.
Yeah.
Okay.
So and then actually your lymphatic system takes over and
interesting.
You excrete it out. So that's kind of how I explain the muscle work too. When you do a bunch of lifting, like let's say I'm just doing a bunch of bicep curls, right? You're tearing that muscle so that it will grow, right? And when you tear that muscle, lactic acid is released. Where does that lactic acid go? Well, sometimes it stays right there and it clumps up into knots. You get the knots up here, you get knots in your muscles, and you're like, man, I get these knots out. So I always tell my athletes, hey, best thing to do right after you're done working out, whatever muscle group you just hit, let's go foam roll that. Let's go loosen that muscle up, keep it, keep it super active. When I do muscle work on a muscle that has been acted like that, I'm moving all of that lactic acid to the lymphatic system where you excrete it. So when we activate the lymphatic system, your body naturally gets rid of those toxins that way. Okay. So that's why we want to foam roll muscles, get them loose, get them active.
Yeah.
And then...
Okay, so foam rolling, and I asked you this, and I think this is an important point to be made. When is the best time to foam roll muscles?
Yeah, so this is also kind of a big topic right now too.
Yeah.
A lot of people are doing before and after. The most important time to foam roll is when your blood is still flowing and when your muscles are still warm. It's less painful.
So not when you're dead.
Yeah.
Note.
Absolutely.
You have to be alive for this.
Absolutely.
Blood flowing.
Got it. Yeah.
Okay. Okay.
No, I got it.
Okay. And you can foam roll before too. Say you're getting ready to do some squats and you're like, I want to foam roll my piriformis, which is the butt muscle, right? Mm-hmm. There's a specific way to do it. So you're foam rolling and then you go do your squats.
I wish we had a bigger area. You could have actually...
Yeah, showed a bunch of stuff.
Well, we'll let people come to you for that.
Well, so I was gonna create a bunch of videos. I was gonna do foam
you still
rolling.
should.
Well,
you still should. TikTok, Instagram, all those.
And I want to, but we took off so fast that I don't have time to keep up.
Yeah.
You know what I mean? Like I was gonna market. I've never marketed.
Yeah.
I've never had to.
Yeah.
I moved to
you.
Springfield and I was born and raised here, so I already know everyone.
Yeah.
All my athletes, all my friends, so it's like just get some of them in. If I'm good, they'll tell other people.
Absolutely.
So I'm all word of mouth.
Yeah. Word of mouth
That's
is the
awesome.
best marketing.
It is the best.
So how long have you been doing this here then?
So I started my practice, April of 2021.
Okay.
So this is my first full year.
Okay.
This year, of 2022.
That's badass.
It's kind of cool, man.
And it's a great looking place too.
It is nice.
It's nice.
We got lucky.
Yeah.
It was Allstate's building.
Yeah, no, I remember that.
Yeah, so I went in there and I talked to Brian, who was the owner of Allstate, and he was renting a room for $500, and I was like, hey, can I take your room? And just, I was doing mobile chiropractic. I was going to people's houses, just trying to get my name out there. Mm-hmm. I moved home, bought some property, and I had a job waiting for me here. Mm-hmm. So that's why I moved home. As soon as I moved home, COVID happened. Yeah. And who was going to give me that job said, hey, man, we're shutting down. We're not, I can't take you on right now.
Blessing in disguise.
But very scary.
Of course.
I went through a lot of feelings, man. A lot of depression, a lot of scared feelings. It's like, well, I don't know what to do then because I had this job where I was going to make money to pay my mortgage and all my bills. And thank goodness my wife now, she had a really kick butt job. Mm-hmm. I gotta watch my language just in case some of my patients.
That's all right. That's all right.
But she had a good job where she could kind of, make sure we're good financially.
Yeah, for
and
sure.
I could try to start a business. And man, it was very scary trying to start a business because you don't know what's going to happen. You don't know how well you're going to do. What's the right move? Are these?
Absolutely.
It's just scary.
It's business. Yep.
Yeah, and so that was in April 2021 when I started it. July of 2021, I took the whole building over.
Oh, wow.
So we got real busy within that first few months.
Yeah. That's fantastic.
It was really cool.
And now you're foam rolling like a mofo. So let's get back to foam rolling.
Oh, sorry.
Hey, I got all day. We can talk about whatever you want,
You're
man.
foam rolling through the whole thing. So let's so again, going back to what my question was, and I love that we got onto that because that really puts people into a perspective of, hey, you got to grind to make it work, and you did, and but you also have to trust yourself.
Yeah.
Your wife trusts you, you trust yourself, you made it work, and it's working.
Yeah,
which is great. Foam rolling though,
yeah, let's talk about it
before and or after, but go ahead and go back to that because we were talking about some people like to do it before.
Yeah, so personally, and this is my belief, and other chiros might feel different, PTs might feel different, but the best time to foam roll is right after you're done working that muscle. Okay. When the lactic acid's still floating around, when your muscles are still warm, that's when you want to disperse it. You want to get your lymphatic system activated so that you're excreting those toxins, because if you do, you're going to build more muscle in that area. Okay. If you don't, then that lactic acid is going to clump up, it's going to turn into those knots, right? And you don't want that in a muscle, not when you're super active like you are and you're working out 5-6 times a day or a week. Right? So that would be wild. I believe it though.
Right. So no, that's good because I'm always sore, and I I need to foam roll. I need to, and the ball you were talking about, the
lacrosse ball.
I need to get one of those because there's always something on me that's always sore. Mm-hmm. But when you rubbed me out, damn it, it's right there.
Set it up.
Yeah. Mickey was supposed to hit that one. But, anyways, when you massaged my muscle tissue before like the adjustment, that was like, for me, that was great. That was amazing.
Yeah. Loosen you up.
Well, it did. And my body felt so much better than and I'm not saying my normal chiropractor that I've gone to for a few years now. He's great. Dr. Gorman, he's great.
He's a really good chiropractor.
Yeah. Mm-hmm. Oh, he ton of people that I've referred a ton of people to him, but he's very specific. He's very, keyed into what needs to be done. Occasionally I do leave sore. Mm-hmm. And that's just the nature of my body, but I feel like the muscle rubs, God damn it, it's right there again.
The muscle work.
Yes. I think that's so much. Yeah. That's almost full picture.
Yeah. Does it help to like loosen up the muscle so that the joint moves easier?
That's why I do it. Yeah. I do 30-minute appointments, and for about 10 to 12, sometimes 15 minutes, it's muscle work. Okay. It may be deep soft tissue muscle work. It may just be some effleurage where I'm just kind of loosening stuff up, warming
effleurage, that's a fun word too.
It's a fun word, yeah. It's a massage term. But I do a lot of joint stretching too. So like I'll pin your sacrum down and I will open up L5, I'll open up L4 and L3. And so, but I'll do holds and I'll have you breathe and relax. And so I like to stretch. It's kind of my own traction. Mm-hmm. I can't afford a real traction unit yet. Give me another year, and then I'll have me a DRX 9000, obviously.
Nice.
Which is like a decompression machine, and it pulls at certain loads for your neck and your low back. And I think traction is super, super helpful. We had it in California.
Yeah.
And it changed a lot of lives. Yeah. It's really good.
No, I think it definitely helps. Even so I was having some issues with my lower back, and he had me wear this belt that like filled up with air, but it would like open up my...
Essentially traction belt.
Yeah. And it was amazing. It
feels good, doesn't it?
Yeah. Mm-hmm. Yeah. I feel like it's never made me taller, though.
It's keeping you from getting shorter.
That's true. That's probably true, because those squats aren't helping.
Yeah, absolutely.
Yeah, traction is for sure important.
It is.
Yeah.
So again, going back to now let's go back to your little hustle. So COVID hit. And then that's when like business was like, it's time to be had, right?
Yeah.
So how did that, I know that you were going through feelings. I know that but what made you take that leap? What was like, I got to take this leap?
Yeah. Well, let me start off with, I'm still with my high school sweetheart. Yeah. Right. So she's always had my back, and she saw that I was kind of moping around, and I was honestly just doing a lot of waiting because I was trying to get in network with insurances. I was waiting to get my NPI started, my type 2 organizational NPI for my business started. There's a lot of loopholes you have to do to become a business, and so there's a lot of waiting too. So I'd be in bed, just on my computer and just depressed and like pissed off, It's like, why isn't this happening faster? Why am I not network with everyone? And my wife, now, she wasn't then. We just got married 2 months ago.
Yay, congratulations.
Yeah.
Oh. Sorry.
I like that one. It's very fitting.
It is, if you're high school sweetheart.
Yeah, congratulations.
It is.
Congratulations.
But she kicked my ass in gear. She called me out. She was like, "Stop being a little bitch."
Yeah, good.
Let's go make some fucking money.
Hell yeah!
And I was like, "All right, you're right. I'm sorry. I'm gonna get out of this funk." So then I started looking at places to rent, and I found this guy at Ryan at the Allstate. So, and then after that, I had to get people in. So what I did was I went to Dr. Hero and Dr. David at Body of Light. Actually, it was Dr. Hero. And I said, hey, you guys are booked up 3 months out. If someone calls in and you can't get them in, send them my way if you want to. I'll totally take care of them. And Dr. Hero, who's a really good friend of mine, I worked for him when I moved back here. He's who got me to go to chiropractic school.
Oh,
Didn't quite finish my story of the whole chiropractic with Paresco.
We'll have to come back.
I jump around a lot.
But we do too.
So do we.
It's fun, right?
We wander.
I know. That's what's fun about it, though. So Dr. Hero actually, he took me under his wing a long time ago in 2014. I worked for him we became really good friends. I watched his house. He's got an awesome house with a built-in basketball court indoors right next to it.
Nice.
So cool. I was like, I want to be a chiro. Absolutely. Right. So he started sending people to me. And then he told Dr. David at Body of Light about me and said, hey, man, there's this really cool kid. I want to help him out. Just get him some patience, help him get started. Yep. And Dr. Hero was the one who told me, dude, you need to start your own practice. Like, I want to bring you on, because it was Dr. Hero who I was going to work for, Hero Chiropractic in Springfield. Yeah. He's my favorite chiropractor here in Springfield. Cool. Dude's amazing. Yeah. Great adjustments. He comes into my office once a month. I'll go into his. We'll adjust each other. Like he's a really close friend. Yeah, good. But you know, he's who started sending me people. Talked to Dr. David. David started sending me people. David talked to Dr. Shirk. Dr. Shirk started sending me people. So this community of chiropractors here, it's the greatest community because they're all trying to help each other out. Yeah,
that's how it should be too.
And they're all different. Dr. David is different than Dr. Hero, and they're both different than me. You know what I mean? So we're all completely different. We do different things. Dr. David, I actually worked for him for about 2 weeks or whatever, because he wanted to go on vacation. So I got to go help him out and treat his patients for him while I was at my new office working 2-3 days a week, just trying to get started. Yeah. So he helped me out a lot too. Awesome. Dr. David's a really, really cool dude. Yeah. But yeah, that's kind of how I got the business started.
Cool. Yeah.
At least with the marketing part and growing. And then it turned into, word of mouth. Cool. So they got me started. I owe a lot to Dr. Hero and Dr. David and Dr. Shirk and all the boys that helped me out. Yeah. You know what I mean? Which I think is super cool.
That's absolutely.
I'm going to pay it forward one day.
Yeah.
Oh, yeah. And that's how businesses should be, especially good ones. Like, I feel like it's not like that in my industry, like the detail business. Everybody wants to have every client, and it's like, no, you really don't.
But you don't have time for it. Well, that's
you don't have time. And you just don't want everybody. Right. Like for me, like in the auto detail industry, I send cars to different shops all the time. And not very often I've heard of somebody sending me cars, which is fine. They want to keep their clients, because if they come to me, they're probably not going to keep them. But I wouldn't try and steal anybody.
I've watched you when you were in your zone, man.
Yeah, right.
I saw you in there when Trevor and I came in, and I was like, dang, this boy goes hard.
I do. I get into it. It's my zen. It's my zen. Yeah. But businesses should network. That we should help each other out, and it's like that. Yeah. It's a jealous industry apparently, and that's the problem. Anyway, so go back to the missing part that you were talking about.
The missing?
Yeah. Well.
Jurisco.
How I got started in this, right?
Yeah.
Yeah, so I went to Dr. Ort, and he explained, what chiropractic and what adjustments are, and the way he said it to me just made so much sense, and I didn't think it was juju, witchcraft anymore. And I got into that a little bit with you guys, about all, what it is and what he explained it, how he explained it. I need proof. I'm one of those. Yeah. That's why I went to Southern Cal University of Health Sciences, because it's an integrated school. They have physician assistants there in the class with us, right? We've got it's different than most other chiropractic schools. The one in Portland, I'm told, is really good too, but it's strictly chiropractic and chiropractic philosophy, which is cool. That's for some people. I'm more sports related. I treat a lot of athletes. Yeah. I treat a lot of the athletes here in this town, but I also just treated a 1-month-old baby yesterday. Wow. Yeah. Wow. And then right after that 1-month-old, I had my 93-year-old come in. Oh. So like I literally do from 1 to 93. Yeah. And mentioning you want your quality and your patience, I don't really turn anyone away. Yeah. I let everyone come in. So if you've got some issues going on, come on in. Yeah, I'm going to help you. Absolutely. But I treat them differently. So my 93-year-old, I'm not adjusting her neck. What I'm doing is I'm going to take it to the side like I'm going to adjust it, and I'm going to stretch it. We're going to go down a segment, and I'm going to stretch it. Gotcha. And we're just going to loosen you up. We're going to create motion. We're going to do stretching and motion and coupled motion so that joint is free and it's moving. Yeah. We don't need to be aggressive with it. Yeah. And so I've actually gotten really popular with a lot of 90 to 96-year-olds. And I've got quite a few that come in. That's cool. And I love them, man. They're super cool. Medicare doesn't pay me anything but $17, so it's not a good business,
Well, it is from a perspective that you're actually helping somebody.
And that's why I got into this, man. Yeah. I didn't get into this for the money. Yeah. I knew the money would follow. I needed to be passionate, and I needed to really focus on what I know and what I can teach people.
And what you love to do.
Exactly. And I love chiropractic.
That's awesome. So tell me about the 1-month-old. I mean, who says, hey, let's go get my
She was colicky and she wasn't
I've had
pooping.
my babies adjusted.
Okay.
Mm-hmm. And you can get them adjusted right out of birth.
Yeah, no, I have
Absolutely.
no doubt. I'm just curious how
And it's different. Like I said, it's different adjusting a baby like adjusting you, right?
Yeah.
It's
So the baby was colicky?
Yeah, it wasn't pooping.
Okay.
And she had heard that, if you come in, you can get your baby adjusted and it can help with some of that.
Yeah.
And she brought her in and I did my thing. I did my muscle work. It's more like mobilization.
Yeah.
We're getting little joints to move. And she was, she's arching pretty hard to one side. So, I'm doing a lot of stretching and opening up and trying to get her a little more straight. And, by the end of sorry, my business phone's going
all right.
off.
Business
I've got
man.
2 phones.
Yeah, nice.
They can wait till Tuesday.
Yeah, right.
But yeah, so the baby, I did my thing, adjusted her, and it's not cracking. I'm not taking the neck and snapping it or rolling her on her side and popping her,
Yeah, of course.
For her thoracic, I will give little movements in there, and she did pop in her right SI when I did like a little mobilization, and it was super cute. It was so adorable. Pop! She started pooping the next day, though.
Oh, see?
Yeah,
Nice.
so, and whether it was from me or whether she was going to do that regardless, who cares? I got to treat a baby. It was the cutest thing.
That's cool.
But I've treated her 3 times now.
Cool.
Well, when you think about like when the baby's in the womb and like the trauma that the body goes through the birth process and whatnot, it can be hugely beneficial because like even if say they're stuck in the birth canal and like the pressure that puts on their neck or whatever, like I always had my babies adjusted also.
Yeah.
Huh.
I didn't know babies could get adjusted until I went to school.
Yeah,
And I was
took
like,
my.
wow, that's crazy.
Yeah.
I think my oldest, I took her and she was like 2 days old.
Yeah.
And had her adjusted.
Well, and it's not that I wouldn't think that they would be able to be. It's what would be the point of it? You know what I mean? Because I'm always thinking from my perspective, I'm always fucked up. I'm always injured.
Yeah.
I need to go get lined up.
Yeah, that baby just went through all that trauma.
Yeah.
Like
well,
what
that
you
makes
said.
sense now.
Yeah.
When you think about that.
Or even
in those
like
terms.
stuck in like a nursing position, like if a baby favors a certain side or something, when you're like this all day, or like half the day, it's a baby.
Right.
True. Like all of that stuff. I just don't think people.
Yeah.
They just don't think about it
They don't
because
think about that.
it's not common.
Yeah.
Right, but it's super important.
It is, and it's totally safe for those that are listening and have babies. It's totally safe.
All my kids are alive.
They are. They should be. But what's cool is I taught those parents what I do and how to do it. And so I told them what to look for and do some muscle work on your baby. Give your baby some love.
Yeah.
Do some muscle
Well, it's
work.
like bonding time.
Yeah.
Oh, yeah.
The baby loves it, man.
Yeah. Oh, I have no doubt. That's cool.
You could see her face when I was doing this. She was like, it was super cute. Her dad was like, "Oh, she's making a face. She loves it." And I was like, "She does."
It's the gas face.
Yeah, right. I'm gonna poop. So, do you have babies? You have kids?
No, man.
No?
We, like I said, me and my high school sweetheart, we just got married. We've been together 16 years this January.
16 years.
Yeah, long time, man. Long time.
And just got married.
I know. And
That's where the crickets come in.
Yeah, right.
Yeah, there it is.
Right.
Yeah, so she, I told her I wanted to wait to get married until after I graduated from med school. I wanted to have,
That.
Yeah, my shoes under my feet, basically.
Yeah. Yeah.
I wanted to make sure that we were set up, basically, before I had kids and brought them into this world, or even get married. So she waited a long time for me to even propose, which, says a lot about her, too. Most women would be like, okay,
I'm out,
buddy.
I'm out. Yeah.
But she knew it was coming. We're best friends. We've been best friends since we were in high school.
Yeah.
So,
well, and she works for you, right?
She does
she
now.
work for you full time now?
She does, yeah.
Sweet.
I had a front desk kid that I hired, and then he left and went to the Marines.
Oh, okay.
And he actually goes to your gym. So
Cool.
You might know him, Austin.
I know a couple Austins.
Little blonde Austin.
Maybe.
Super cute kid, man. He's super cool. He turned 21 when he was working for me.
Cool.
But, he was great. I loved having him, but, he wanted to go on and do his thing. And so after he left, it was like I started looking to hire another person, maybe a CA, someone to help me out. And it was like, well, damn, Ash isn't working anymore. She's just hanging out. Why don't you come in? I'll teach you the business.
Cool.
You could be the manager, and then when we are ready to hire more people on, she could be that role. Yeah. Basically. And she's been awesome, man.
That's good.
She answers my phones. She wants money, so she's calling insurance.
Yeah,
she's calling
right.
those motor vehicle accident, adjusters, and she's like, "Where's our money?"
Yeah.
Where if I had someone else, it's
yeah.
like they'd be like, "Well, I just called. I'll call tomorrow." She's like, "I'm calling 3 times."
Well, when it's your own business, it makes a big difference.
It's her business. business too, you know. So she's like working extra hard.
Yeah, she's got that. She's invested. Not to mention the cool part about that was she was the one working prior to the business, right?
She kept us alive.
She kept you guys afloat, and now it's like you guys are in this together. That's awesome.
Yeah. So we're kind of tag team in this business.
Yeah.
And it's been really fun, and I like having her there.
Yeah, of course.
She's nice to look at.
She's very pretty.
Yeah, I won't get in trouble for kissing my front desk, which is a very big thing.
Yeah.
Like when I moved to Oregon, I had to go through the jurisprudence process, and then there was a class, and it was like, do not have sex with your patients. Do not have sex with your patients.
This should go without saying, but
it should. But do you know how many do and how often it happens?
I imagine.
Probably a lot.
I imagine
It's a lot.
Wow.
It is a lot. Wow. And it's some people may not be getting attention at home, and then we put our hands on people, and people want to be touched. Like you want to have that love. You know what I mean? We all want love.
The intimacy.
Yeah. So,
or their perceived intimacy.
Exactly. So you got to be kind of careful.
Yeah.
For sure.
Well, and that's one thing that I did notice about your office when we were there, and I thought it was cool, is you left the door open.
Always.
Yeah.
Always.
I think that's the classy act. You know, not to say that having the door shut, because some people like the privacy, they don't want to, but to me, it's just a classy act. But
well, so in California, I worked for a really, really big office where we would have, our Irvine office had 5 or 6 tables all right next to each other, and there'd be a patient on each one of them, and a CA or a PT or a chiro doing muscle work or doing whatever they're doing, and you're in there for an hour because we had medical, so you go see the nurse practitioner, get a lidocaine injection or a marcaine injection if you needed it, right?
Yeah.
Breaks down, lactic acid where the scar tissue's built up right there, right? So it works really well, but you go see them, then you go to the PT, you'd get muscle work, then go see the chiro. So it was like this little train of what you would do, and then you'd go do exercises. But there was tables all laid out next to each other, so there was no rooms. We would do the initial exam in a room that was more private.
Gotcha.
But once we started treating, it was all out in the open. And I worked in Mission Viejo at Gateway Rehab and Wellness Center. Best office. Super cool dude. Vic, one of my best friends, came to my wedding, came all the way down.
Right on.
Anyway, so I worked with him, and we had three tables in the PT room and 2 or 3 in the chiro room. He bought the office next to us and expanded, knocked down the wall. So we had a chiro and a PT section. Oh, cool. But it was all out exposed. So that's kind of what I wanted. I don't want single rooms. I'd kind of like to have more, people working for me. Yeah. Like, CAs or front desk, and I just like the camaraderie. I like having fun. I don't want to be just by myself in a room. It's boring. Yeah. So I'm a little different than most of the chiropractors here in Oregon in that aspect as well. But I like it. Cool. I like it. Yeah, absolutely. Yeah.
Well, I mean, as long as your clients are okay with it, I mean, that's great. Yeah. That's great.
Yeah. There's a few, that are like, hey, can we, shut the door or whatever, because I'm working on a dude's shoulder and he's taking his shirt off. He's like, just shut the door. It's like, okay. Yeah. If it was a female, I'd be like, no. Yeah. I can't shut the door. Yeah. Or I could bring Ashley in or have someone in with me. Yeah. You got to be careful. You never know what's going to happen. Someone can say whatever.
I would imagine like a minor. Oh, also same thing.
Yep. Well, that's the problem is anybody can say anything.
Exactly. Whether you did it or didn't. It's like, I'm not even going to risk that. Yeah. Like, I love my job so much. I'm not risking any of that. Yeah. Right.
Well, when I got going early on, I've had employees work for me in the past, and I tell them, I said, imagine there's a fucking camera recording you while you're in this car. You know what I mean? If there's a penny in this fucking car when you're in detailing it, that penny better fucking still be in that car. Absolutely. When you're done. Yep. You know what I mean? So I just, not that there was ever, or we were worried about that, or I was worried about that shit, but it's like, imagine there's cameras on you at all times. Yeah. Don't sit there and pick your nose and, you know what I mean? Just funny shit or stupid shit or doing dumb shit. Yeah. That's just the way it is. And that's just the society we live in as well, too. Oh, yeah. You just got to be careful.
Right. No, I hear you there.
I mean, because there's a lot of scandalous people out there, though. I mean, you just said it. I mean, there's a lot of people having sex with their fucking clients. That's weird to me.
Or their front desk.
Oh, yeah.
Which I am, but...
yeah, that's true.
But that's my wife.
But she's your wife. It's legal. Oh, man. So let's switch gears. What kind of lifting do you do? I know you're buddies with Trevor. You guys are you guys close or?
Yeah, Trevor Ryan and I grew up Best buds.
Okay.
We went to Oregon State together. He moved in with me and a few roommates for a little while. You know, him and I have always been super close.
Yeah.
But I do a little different style lifting. I'm a little more active, I guess. I guess you could say I CrossFit, which you know is kind of like a cult. But, I mean, it kind of is.
Yeah.
But I enjoy it. I just do my own thing.
Yeah.
Like I go to Treeline CrossFit.
Oh, I was gonna ask where you go.
Yeah, Treeline, Justin Aaron's, super cool dude. Their whole facility there is awesome.
Oh, yeah,
it's
yeah.
gorgeous there, and they got showers, so it's perfect.
Yeah.
And it's right down the road from me.
Nice.
Oh, do you live over there?
Well, my
Oh,
Q
yeah, your
Street.
office, yeah.
So my office is, you can almost see their office from my office.
their building,
Or
yeah.
Their yeah.
Yeah.
But so I CrossFit, but I do things a little different. So I keep everything strict. I don't do kipping pull-ups. You know, I do strict pull-ups. I go slow. When they want me to run and do heavy lifting, you know, I take my sweet Jesus time. Man. You ain't getting me moving faster than what I want to do, you know, because I can't get hurt. You know, if I injure myself, then how am I going to treat all the people that are injured? Which
so when you go to CrossFit, is it like you're doing their program?
Sometimes.
Or can you
I make up my
because you
own.
say you go in and do your own thing,
because I go during lunchtime when it's open gym.
Because they have classes you can go to.
Gotcha.
Yep.
And they usually write like the workout on the board, right?
Yep.
So you could do it if you wanted.
I could.
You'd just be doing it on your own.
A lot of it's snatching and overhead lifting, which I don't do anymore. I was in a pretty good motorcycle accident in California. This elbow was facing the other way.
Ugh.
So anytime I do anything overhead, it just feels funny. Like it could just give at any time.
God.
That's
so,
terrible.
So I avoid any like heavy overhead lifting.
Yeah.
If it's like strict shoulder press, you know, I'll throw up 135 on the, you know, and I'll get like 4 or 5 in. You know,
Jesus, 135.
I know.
Not lightweight.
Well, I'm just saying, like I can do it, and I feel comfortable.
As long as it's like strict and.
But pulling and doing a motion like this, like I just don't feel comfortable. So yeah, I usually switch that up, or I do a lot of Cindy's, man. Where
What's that?
Well, let's make sure I'm saying this right. I think it's a Cindy. It's where you do let's see, 5 pull-ups, 10 push-ups, and 15 air squats, and you do as many rounds as you can.
Oh, okay.
Jeez,
It's a really good full body workout, and I love it.
That's called the Cindy.
Yeah, and I'll do that every day. I don't get bored of it. It's sweet. When I go in there, they're like, "You doing a Cindy again?" Yeah. Yeah, because you're kind of hitting almost every muscle group.
Yeah.
Yeah.
And it's all body weight stuff. So.
And then the next day I might lift heavy. I like doing legs. I'm a leg guy. I don't usually bench. I don't do any kind of press motion. I do more back just because we're also naturally like this already, you know? So I focus on strengthening rhomboid, lower lat. Yeah, I'm trying to get my shoulders back a little bit more.
Yeah.
You know what I mean?
I have a very bad range. That's it. Boom. Right there. That stops. My range of motion is horrible on.
That's why you got to start foam rolling that subscapularis.
I know. Well, when he showed me that, he showed me how to foam roll properly.
Yeah. Did we do the subscap?
Yeah.
Did we?
Yeah.
Okay.
Well, because I told you I had some soreness in here, and we got right in this back area right here.
Yeah. With my thumb or on the foam roller?
Oh, the fucking thumb too. Woo! No, you got the thumb right. Yeah, you did do the thumb, and your room got dusty too. See, these rooms get super dusty, and my eyes start to water a lot. Yeah. The girls were there.
Like, Dad.
Yeah. The bad thing about that was there's pain, but I'm very ticklish.
Yeah.
That sucks.
We had to go quick. I grabbed quick and started motion.
Well, and you did something where you were moving my arm, right?
I did the motion of the subscapularis.
Yeah.
So we pin it and we do the motion of that muscle.
Yeah.
And that's how you get that muscle more loose, basically. That's how you release all of the tension in that muscle.
Yeah, and it felt amazing afterwards.
Yeah. It's an active release technique, basically. And you have to be certified with ART to do that kind of stuff.
Okay.
So I do a lot of ART work. I do a lot of MFR work. Random words.
What's MFR?
MFR is like myofascial release.
Oh, okay.
So same concept. It's just done differently. There's different grades. You can pin a muscle from shortened to length or from length to shortened. You can do whatever you want, basically. So I usually have kind of I have in my head what I'm going to do each visit. When you I don't know what I'm going to do until you get there and tell me how you did the last visit.
Oh, okay.
And then after you do that, I just make it up in my head. Well, we're going to do this now because this makes sense to me.
Yeah.
You know, so I kind of wing stuff.
No, that's
when
cool.
I'm in the practice, but it's, you know, I give my 100% on every patient.
Oh, yeah.
So
Yeah.
it's not like I'm guessing. I wait until they get in there, and then
well, it's hard to know. Like, who knows what happened to them the day before?
Yeah, absolutely.
Right? Maybe they twisted their ankle.
Yep.
Hard to say.
Yep.
Well, and you did that thing with you kind of pulled on the knee, loosened it, and then pulled it, and I felt like this went and this went, and it felt great.
Yeah, it was just a simple
Still
hip
not
pull,
any taller, but
no, but those joints were released, so
yes,
they're not going to be as compacted.
Yeah, that's true.
You know, a lot of my athletes, their favorite adjustment that I do is the hip pull.
Really?
Yeah. I used to work on this crazy good athlete, Giuseppe Lentini. He was in my wedding. He's a badass CrossFitter, dude.
Oh, cool.
The dude can snatch a lot of weight.
Really?
Yeah, he can. But that was the biggest thing. And he's a big boy. He's got his name's the Quad Father.
Oh, wow.
On Instagram, you should go follow him. He's got some good stuff, man.
Yeah, cool. I'll check him out.
But yeah, so I would do hip pulls on him, and I'd have to get like a running start. I'd have to lean into it, get like a little curl hop, and you'd feel his hips just go.
Yeah.
And it's like, oh,
wow.
Did that feel good? Okay, all right. Okay, if it was good.
Yeah. So how is that? Because I mean, you're not the biggest dude in the room. So how is that to adjust? Because you were just telling me you had like big old basketball players in there.
6'8", 330 pounds.
How is that to be able to maneuver with these dudes that are just massive?
Yeah. I'm pretty little, but I got a little strength behind me.
Well, no,
too.
and I have no doubt. It just seems like it would be difficult.
It's different. So like I'm going to adjust that person slightly different.
Okay.
You know what I mean? Like, someone who I could kind of manhandle and do my own thing with, I'll adjust them slightly different than like the big boys. Mm-hmm. When a big boy comes in, I open up their leg a little differently to get their low back. Otherwise, I wouldn't be able to hold them on the table.
Right? Yeah.
Which my boss back in Cali taught me how to do that because we worked on some really, really famous people down in Orange County.
Cool.
Yeah, and some big boys, like really, really big.
Yeah.
So I was like, I don't know how to adjust that guy. And he's like, well, just do it like this. It's like, oh, why didn't they teach me that in school?
Wow.
School, man. Yeah.
Because I think about Gorman.
Yeah.
He's an older guy.
Yeah.
And it just seems to me that it would be so difficult to treat like a 300-400 pound dude.
Yeah. It could be. You just do it differently. Where I might adjust you face up through your mid back. Mm-hmm. I might have to adjust that person face down. Because I got,
Yeah.
I got to
your
get
wingspan.
around.
Yeah,
you know what I mean?
Right.
And
yeah.
if you're bigger than this, I can't do it.
Yeah.
So yeah, definitely. Some chiropractors that are bigger have an advantage for sure.
Oh, for sure.
But with that being said, I went to school with this little Vietnamese girl. Her name was Ha. Super cool chick. She can adjust anybody.
Wow.
And, she's little.
Yeah.
And you could take any of those football players and she will get them to move as well. It's just you do it differently.
It's technique.
Oh, yeah. You might got to jump on them a little bit.
Yeah.
Yeah.
I guess technique is overall what anything really comes down to.
Yeah. And with adjusting, it's speed.
Oh, okay.
Yeah, a lot of people think it's like you just gotta go really hard. It's not about that. It's quickness. You got to be quick. And if you're quick with the joint, it's
gonna go
easy. Yeah.
Huh. Interesting. Yeah. What is your take on like? Have you ever indulged in like acupuncture or anything like that?
Yeah, we had acupuncture in California at my office. I did it quite a few times. Yeah, I love acupuncture.
Okay, so tell me why though, because I've always looked and I've had acupuncture. I kind of looked at that as like witchcraft type of stuff. I mean, does it? I understand the electric, it's like a for your electric body type of thing. But tell me something about it.
Well, I may not be the best person to ask about it because I'm not an acupuncturist.
Yeah, no, I get that.
So I don't know exactly what all goes into acupuncture. Mm-hmm. But it's very similar to chiropractic in a way.
Yeah.
It's just.
Are you manipulating the nervous system or the electric system or what?
That's a great question.
Okay. I don't want to put you on the spot with it. I guess, do you, in your opinion, is acupuncture also one of those things that a person should do regularly?
I think so. I mean, if you've got issues and you can't figure out why or what's going on, and you've seen chiropractic, you've seen physical therapy, you've been to the medical doctors and prescribed the medication. Yeah. Why not give acupuncture a shot? And a lot of people do, and it works for them. Yeah. I liked it just because of the way it made me feel. She would focus on like liver stuff with me. Okay. So it wasn't about like muscle pain or muscle aches. It was like, damn, I throw back some whiskey.
Yeah.
And I drank every night in California, and at least 3-4 glasses of whiskey. And then I was addicted to whiskey, man. I loved it.
Yeah.
And so I was like, hey man, my liver's been a little sore lately. And, he did a bunch of stuff on me for the liver and then for my kidneys as well. And yeah, it felt amazing.
Really?
It did.
Wow. That's interesting.
Yeah. So they don't just focus on like muscle pain. They can focus on like internal organs and stuff.
Yeah.
But I don't think, I'm not the one to talk about acupuncture.
Yeah. No,
I don't know a whole lot about it.
Okay.
I know a little bit, but if I say something, I don't know if it's fully correct.
Yeah.
You know what I mean? So I'm gonna leave that to an
Well, and that's where, and the reason I ask that is because a lot of people look at chiropractic treatments as that kind of, what's the word I'm looking for? Mickey, you should know the word because nope.
Nope.
Just one of those offshoot type of things, not like a mainstream type of medical treatment or anything like that. You know what I mean? Where I'm just the opposite. I think it's very vital.
Yeah, that stigma with chiropractic.
Yeah.
You mean? Yeah, absolutely. What's funny is in California, medical doctors and chiropractors, they kind of work together.
Yeah.
They communicate, they talk, and medical doctors there will say, hey, you know what, you should look into, chiropractic. Mm-hmm. The guy in Corvallis that I saw, he also mentioned I should do chiropractic, but most doctors here, most medical doctors are like, you don't do that. You shouldn't go to a chiropractor. You're going to get hurt. That's not what you should do.
And I've heard that before. Yeah. I've heard people telling me stories that their doctor's like, no, don't do that.
My patients,
they got bad necks. Don't go see a chiropractor. It's like,
what do you mean? I got a protruding disc in my back. Don't see a chiropractor. You should definitely see a chiropractor.
That's the reason to go see a chiropractor. I'm proof positive of that.
Yeah.
It literally drives me insane when I hear people with neck issues, with back issues, and they're like, my doctor said not to see a chiropractor. It's like, you fucking idiot.
Mm-hmm. Yeah, there's a stigma to it.
Yeah.
And it's, honestly, I knew that stigma when I went into it, and it was, I almost felt ashamed when I would tell people I'm a chiropractor.
Really?
Almost. When I first started, mm-hmm. And when I was going to school, people are like, oh, what are you going to school for? I'm like, I'm going to be a chiropractor. Oh.
Yeah.
One of those. You're not a real
witch
doctor.
Yeah.
Yeah. It's like, you didn't go to school for 10 years. I got the student debt to prove it.
Yeah.
But that's why I became a chiropractor too. I want to change that stigma.
Yeah.
Chiropractic is great, and I help a lot of people.
Oh, yeah.
But you got to do it the right way. So if you got something going on and you do have a disc protrusion, I'm going to treat you differently than what I would treat you if you didn't have it.
Yeah, but absolutely.
I'm still going to adjust you, and I'm going to do certain things. I'm just going to do it differently. And you need that. You need to open up the joints. Sometimes, your back's gone too far, and chiropractic won't help. And I got to let people know that too. I've got a lot of patients that come in and, well, we're going to see what we can do. Okay. Yeah. And by this day, if we're not feeling like we've gained or had improvements, then let's refer you out to pain management.
Yeah.
Maybe we do need an epidural or a cortisone shot, which I'm okay with. I don't want you to do those if we can avoid them. But if you need it, why not? I'm okay with that.
Yeah.
When you put a steroid in your body, it's going to eat all that tissue that it touches, basically.
Yeah.
So it's really bad to keep doing cortisone injections or steroid injections.
Yeah.
But you know what? Maybe you will block that nerve with that injection, and maybe you're going to feel better, and it's never going to come back.
Yep.
Or you're going to get that injection and no change.
Yeah.
It's 50-50. Some people do feel a little bit better for a little bit of time. It's just different.
Yeah.
So that's I wanted to change that stigma.
Good.
Because chiropractic is really, really helpful.
Very, very beneficial. Well, and PT and physical therapy. I think they're so hand in hand. It's and lifting and eating and all that good shit.
The massage
nutrition.
Therapy.
Yeah. That's why I do both, though. That's why I do PT work with chiropractic.
Yep.
I've had a lot of patients come in and they go to a physical therapist. I'm not saying, is it Dr. Tyler?
Yeah.
That you work for? Mm-hmm. I feel like
Tyler Tanaka is his name.
Yeah, I've had a patient that came in and they go to him and they love him. But I've had other patients come in about PT and they're like, oh, I was just handed a piece of paper and said, do these exercises.
Oh, yeah.
And it's like, well,
yeah.
Did they touch you? Did they do any soft tissue work? Did they do any muscle work with you? No. They just gave me these exercises. I'm like, well, okay.
Yeah, it's unfortunate. The same thing, like people, because the business model that we have is Convergence Physical Therapy.
Yeah.
Is so much different than like a typical physical therapy office.
Yeah.
It's actually sport therapy, right?
Well, we're expanding in the process of expanding to convergence physical therapy and sports performance.
Yeah.
But
is he younger?
yeah,
Tyler?
he's I think he just turned 30.
Yeah.
Yeah.
I've talked about him with a few patients of mine.
Oh yeah.
Nice guy. Great guy.
I've never met him. I wanted to.
Oh, you should meet him.
I started following him on Instagram.
Yeah.
I'm pretty sure.
Yeah. I'll go look because I do that.
Okay.
That's me.
Is that you? Right on.
She's that behind the scenes one.
Well, good.
Yeah. But anyway, people get that impression with physical therapy is because the business model is so different, right? Mm-hmm. Like they are like kettle, essentially. And so it's different. Like it sounds like you're actually spending time because like when we're talking about chiropractic in the past, like 5 minutes you're with the doctor, right? In and out. But when you're spending like not quality time, but that time with them and getting to know
effective time.
Yeah, effective time. Yeah, it makes a huge difference. But unfortunately, like in the past with physical therapy and chiropractic, that's been the way that it goes.
Yeah.
Right?
Well,
And I think that people like the younger upcoming, like you and Tyler, are a different breed.
Yeah.
And I think that's where the change is happening. Is the real being effective with your profession is what it's all about.
Yeah.
And I bet some of the chiros around here kind of started off like I did too.
Oh yeah, hungry,
and then,
young,
and then
hungry.
you're like getting so busy, which I've thought about going to 15-minute appointments because we're booked up till January 3rd right now.
Wow.
So
Good for you,
it's
man.
crazy busy, and I don't like it.
Yeah.
I don't like it at all. I want to have at least 2 or 3 spots open in my day each day. So when someone's in pain, they call in, they can get in.
Yeah,
right?
that's cool.
But the way I do it is not where the money's at. Right.
Yeah.
So I'm not making as much money as all the other chiropractors doing the 5-minute adjustment, getting $85.
Yeah.
And I only charge $50, and I'm not going to change my prices. Everyone tells me you can't just charge $50. It's not about the money. I'm trying to help that person. Maybe they needed to come in and they couldn't afford it. Right. So, and I like doing 30-minute sessions with people because I can focus and actually help them out. I didn't get into this for the money, like I said. So,
Well, at the end of the day, as long as you're able to take care of your family, like that's what's important.
Well, and the reality,
$100 an hour is not anything to like shake your fist at.
and the other thing to consider is the first visit could be the 30 minutes. The next visit may not need to be.
Absolutely.
So,
and I've thought about that. Like I said, this is my first full year.
Oh,
so I'm learning and I'm thinking about adding some things in and
well, the
trying.
importance of client care should be number one, and that's what you're doing. You're starting off with the honesty, the integrity. Client care is number one because that's where word of mouth comes from.
I think it'll take you further.
Yeah.
When people actually feel like they're cared about, right, and they're not just cattle or just another number.
Yeah.
Yep.
They're gonna share about you more. They're gonna tell other people about you.
Yep.
And they're just gonna feel better overall.
Absolutely.
Yeah. Mentally, emotionally, all that.
I treat a lot of motor vehicle accidents too.
Yeah.
And a lot of work comp. And they pay really, really well here in Oregon.
Well, that's good.
Yeah.
Yeah. Nice.
So if you got a few of those, you're good.
Yeah, right. Yeah.
It's like, oh, you got a motor vehicle accident. Oh, it really sucks for them, but we got a motor vehicle accident.
Right.
So it's exciting when you get those in because it's different than just a cash.
Right.
That first visit, you could bill up to $500 if you wanted to. I don't do that. I don't overbill. My initial's $150, and then whatever I do after, it might add up to like $300 $300.
Yeah.
But they'll pay it in full here in Oregon. In California, you create like a...
it's like a plan?
Yeah, basically. And then you treat them, but that you don't get paid each visit. You send all of your notes with your billing to the insurance, and then they come back and say, oh, you sent us $6,000 worth of treatment. We're going to give you $3,000. And they'll like haggle with you.
Really?
Here, they just, you have PIP coverage in Oregon. So if you're in a car accident, you have $15,000 to go seek treatment with physical therapy, acupuncture, chiropractic, massage. People don't know that when you're in a car accident, you can get massages covered. And it's up to 2 years, but you got to have something going on. You can't milk the system.
Yeah.
Like if you really got injured in a car accident, go get those things done. And some people don't know that you can do that.
Wow, I didn't.
Yeah, I know. I didn't really either until I moved here.
It's good to know.
Mm-hmm. And so, yeah, if you're in a car accident, go seek treatment.
Oh, yeah.
And if you're feeling good, wait, see how you feel. 2 weeks later, you're like, man, my back's actually really hurting. You can still go seek treatment.
Yeah, that's the thing. I think when people get in car wrecks, they're like, oh, I feel fine. But then a week later, they're like, oh, something's
Yeah, my neck is all fucked up.
Like whether the adrenaline kicked in during a wreck or whatever.
Yeah. Well, and I think this is a great place to close, because now you can tell people where they can reach you, how they can get a hold of you.
Yeah.
Give your number, your address, whatever you want to give.
Yeah. So like I said, we are Advanced Sport and Spine Chiropractic. I'm Dr. Justin Coryell. You can find us at 384 Q Street, Springfield, Oregon. I do have a website as well.
You can drop that if you want.
Well,
is it long?
What is it?
Okay.
AdvancedSportandSpine.com.
Okay.
It's AdvancedSportandSpine.com,
cool.
Basically.
Nice.
And I can send you it, and you can throw it in a link or something.
We will do that.
So,
we will do that.
We do have an Instagram, like I said, and it is Advanced Sport and Spine as well. I don't use it as often because, like I said, I haven't had time.
Yeah.
And the time that I do have, I do all my own work. I do all my own billing. I do everything. So it's hard to market and do Instagram.
Yeah.
I know.
Well, I mean, honestly, you don't need to market.
Yeah, no.
If you have word of mouth, then, then you're good.
I've never marketed,
Yeah.
but
for you.
I do.
That's what I mean, like generally. Like, you specifically doesn't sound like you need to market.
Yeah, but like coming on to Wandering Minds podcast is really cool, because then I get out there to other people, about specific things, or maybe someone was interested about chiropractic and didn't really know what they thought about it, or if you have questions, you can call in. What's cool about me is my business phone's a cell phone, so you can text me. So if you want to,
always nice.
If you want to schedule, you text and say, "Hey, my name's blah blah."
Yep.
I want to get on your schedule.
Which is what I did the other day.
Yeah. And our phone number is 541-852-8806.
Sweet.
So just send a text to that number if you want to get in, or give it a call if you want. I only answer it Tuesday through Friday, 10 to 7, because that's when we're open.
Boundaries.
Yeah.
That's good. That's good.
Good.
But
cool, man. I appreciate you, bro.
Thank you.
All right.
Well, thanks for having me on here, guys.
Absolutely.
I appreciate that.
Thank you.